China has been portrayed as an inferno of infection and death by some international media, following Beijing's relaxation of COVID policies in December. In mid-January, official data say a total of nearly 60,000 deaths related to COVID-19 were reported in medical institutions since the relaxation. And more than 90% of the deaths involve underlying issues, such as cardiovascular diseases, tumors, and respiratory problems. The average age at the time of death was 80.3 years, with about 90% aged at 65 years and above. This is truly unfortunate. It is tragic. The deceased could be a neighbor, a friend, or a friend's friend. They will always be in our thoughts and prayers. But the fuss some foreign media are making about China being an inferno of infection and death are apparently blown out of proportion. If you look at the statistics, it's not exactly uncommon for society to experience a rise in cases when it relaxes its COVID policies. There has been a surge in cases in the United States, South Korea, France, Italy, and others when they relaxed their COVID policies. And the narrative back then? Relief, excitement, and a shot in the arm for the economy. And the narrative when China reopened? Wariness, suspicion, and condemnation. They gave the same doom and gloom vibes to the Hollywood movie Contagion. I mean, a movie about a super scary pandemic starring Matt Damon, Jude Law, Gwyneth Paltrow, and Kate Winslet. Wow. Except that there's very little storytelling this time around about the grit, the perseverance, and the solidarity of everyday Chinese, which honestly have been incredible. I mean, I personally went through all this. At the height of the infection, families across China cuddled and stayed through this. Friends, neighbors, community workers, medical staff helped one another out. In fact, my neighbor gave me a bottle of children's Motrin, a ibuprofen-containing liquid for kids, for my 3-year-old daughter who was suffering from COVID-induced high fever. And trust me, I've heard many such beautiful stories of fraternity across the land. The medical staff, many of whom getting infected themselves or risking getting affected, working overtime to save the lives of others. Drug producers operate at full capacity to make ibuprofen, and the acetaminophen daily output of these drugs is now 4 times higher than a month ago. Almost 99% of townships have set up fever clinics, and grassroots-level fever clinics now account for more than 60% of the country's total. That said, delivering quality service remains a challenge for many localities. In early January 2023, officials say intensive care beds total 216,000 nationwide, with 135,000 more beds that can be converted into ICU beds. China says the occupancy rate of ICU beds is now 80%. Again, improving quality, not just quantity of care, remains key going forward. And regarding the travel restrictions against travelers from China, many have come out and spoke. The director of the WHO Europe said the prevalent COVID variants in China have been in Europe since a long time ago. So singling out or restricting travelers from China is not exactly helpful. In a nutshell, people should learn lessons from this public health emergency, and people should also separate facts from fiction and let science be science.